Active care, exercise, and rehabilitation for a shoulder.
Hello, I'm going to talk today about frozen shoulder. It's a problem where you have a hard time lifting up the shoulder, usually due to the muscles going through reactive muscle spasm, and then adhesions start to form. It can progress very quickly. It can be quite painful. A person will not be able to lift their arm. They'll show a lot of anxiety. When I went to school, I was always taught to take something like a weight. So we'll pretend that this TheraBand is a can, hold it in my hand, and I was taught to do some Codman angles or Codman circles or pendulums. Doesn't really do enough weight though to open up that shoulder. I was also taught to teach my patients to do wall walking, walk the fingers up the wall. But I always thought that was funny because if they can't lift their arm, then wall walking is kind of hard and they are unable to do it. So what they could do is come to a table and just do a passive stretching, all the different positions that they seem to need. So if I have the adhesive capsulitis, I could maybe just get my arm like this and maybe roll my seat away, straighten out the arm. And they need to stay in this position. It's recommended that you put a lot of heat on their arm to loosen it up while it's happening, maybe ice afterwards because of pain. And the nice thing is you can stretch out the posterior capsule with one position and the anterior capsule with another position. These are also some of the different techniques that you can use in a bed while you're sleeping in order to stretch out the different parts of the capsule. I could also use something like a TheraBand and simply attach the TheraBand around my wrist somehow. I like to do it like this and just pull away from the wall. Now right now I'm not using a TheraBand. This is actually a different type of resistance loop. TheraTubing works, but you can see right here I'm doing an internal position and an extension. If I had the hook higher, I could have my arm up higher and pulling downward. I can also turn around, get posterior capsule, posterior muscles, lean into it or rotate into it, go down, go up. You can do positions where you're really opening it up or not opening it up as much. Lots of variations. Another very important shoulder rehab has to do with getting the person out of that constant typing on the keyboard position. We're pronated and we're in a flex position. They say, this is the cortical fisting of brain injuries. So here we are putting ourselves in cortical fisting. Brugger came up with this one. You're going to take the TheraBand and wrap it around the hand and wrap this around the hand a couple of times. Now I'm going to use a lightweight band. And the reason why I'm not grasping the band is because that's what we're doing too much. So I'm going to start like this, get my position either in a split stance or a set body with a slight bend in the knees, and I need to go into extension of the wrist and then extension of the elbows and extension of the neck. That's the full Brugger's position. And you want to do it against resistance if you can, but if not, just simply doing this action every day. Maybe every 20 minutes on a back break when you're working on a computer too much. Or perhaps you can lie on a foam roll. Foam roll goes from head to tail, and then you again put your hands in that Brugger position, and then you can go into what I call the W, the Y, and the I positions, and you can just feel what's tight and just let the body relax, let the whole body relax back. Another part about shoulder adhesions, not so much just the frozen shoulder, is the tightness of the pecs. So again, there's two types of pec stretches, the one I showed you where I just lean back, but you can also pretend you're in a door jamb. So let's say this is the door jamb. Put your hand low and rotate the whole body away. It's pretty easy. I don't like leaning in because that's getting more into capsular work and you're not sure necessarily if they need that. And then I'm going to go mid, kind of horizontal straight across, mid zone, and rotate my body away. And then I come in a little bit closer to the door jamb and I go up higher with my arm and I rotate my body away And you should get a lot of different areas stretching out with these. Along with pec tightness, there's also the need to stretch out the lats. That can be done really easily by just leaning against the wall. This will also get your lower traps. Or you could use something like Theraball, and if I were kneeling on the ground, that'd be convenient. If I hurt my knees and I don't like putting my knees down, I can do the ball on a table like I'm doing right here, and basically rolling back and forth. And you can see how that really helps out stretching my whole sides. When you put your hands thumbs up, it's a different stretch. So you just sort of vary it depending on what you need. Sometimes people will take the Theraball, put it against the wall, and again, do some movement back and forth, just stretching different ways. For the shoulder, the most important rehab is going to be working on that rotator cuff. We're really upper trap dominant, we're deltoid dominant, and we don't have that strength of our rotator cuff pulling down the whole humerus. We do almost everything pushing. We push a lot of things every day. Push, push, push. We need to strengthen the muscles that are holding the humerus out. So in my first days of working with a patient with a sore shoulder, collarbone, clavicle, scapula, AC joint pain, first rib pain, cervical thoracic subluxation, scapular movement's bad, I always start them on the beginning, which is to simply have a band in the hand. I like to remind people to always have a weight or a bottle, something about as big as this TheraBand is right here next to the waist. Park the elbow here and do a simple, very safe, non-dangerous position in your external rotation. Now if I wanted to, I could wrap my hands and I could get into the external rotation where I keep my hands more in the Brugger's position or the splayed fingers. Then I could also put that TheraBand on a hook, on a doorknob, put the bottle next to the waist again, and then again, I need to go internal and do some internal rotation. Subscapularis is your major internal rotator of your rotator cuff. And remember, the trigger points of the rotator cuff love to hurt right here. So people come in, oh, my deltoid hurts, but it may not be that. After the person has progressed in this safe zone, then you can go heavier weights, and you can start doing things like a band higher up. And you can start doing them in different positions. Like here will be a classic 90 degrees abducted position with the internal, and then I can turn around and do the external rotation. But that isn't the safest position. So I always start people in that basic safe position. If they show while they're raising up, they have a shrug at the top that's better with their hand rotating out, and then up goes the hand and it feels better and there's no shrug and pain at the top, that's the one where I know I've got a superior humerus and probably a lot of work to go on the rotator cuff and to strengthen the rotator cuff. All right, so thank you.